once again to my YouTube channel, and in succession to the videos from now onwards I'm starting a very important topic in hematology, and which is very important from in the general pathology as well. So students and viewers, from today onwards we'll be starting with, in pathology we'll be starting with the blood anatomy and physiology. So students and viewers, beginning with uh, in blood anatomy and physiology, we'll be starting with the introduction of the hematopoietic system and how this hematopoietic system, it is, what are the functions of it, what is the physiology of the blood, and how this blood is formed in the initial, what is the hematopoietic system. So we'll be studying about it. So students and viewers, beginning with blood anatomy and physiology and the introduction to the hematopoietic system we'll be discussing. So starting with, what do we need to understand it about is that hematopoiesis, the word itself is suggesting that it is the production of formed elements of blood, and we all are very well aware that the formation of the formed elements of the blood, it is called as hematopoiesis. Now the word hemato is referring to blood and poiesis means formation. So how the blood is getting formed and how the formed elements of the blood are getting into the blood circulation. So this process is called as hematopoiesis, and there are basically three constituents of blood, that is the entire bloods, which is consisting of most predominantly the RBCs, which is called as the erythrocytes, the WBC, which is also called as the leukocytes, and the blood platelets, which are also called as the thrombocytes. Now students, beginning with the physiological function of these erythrocytes, the leukocytes and the thrombocytes we'll be studying. So starting with the erythrocytes, you all might be very well aware that this erythrocyte is basically involved in oxygen transport. So this erythrocyte is involved in oxygen transport, and when we look at the function of the leukocyte, so basically the leukocytes are responsible for the defense mechanism against infection and tissue injury. So the leukocytes are basically the cells what are responsible for the defense mechanism against infection and tissue injury. And last, the thrombocytes, they are basically responsible for maintaining the integrity of the blood vessels and preventing the blood loss. So students and viewers, starting with, when we look at the lifespan of these three elements, that is RBCs, WBCs and platelets, what do we find is the lifespan of these cells, particularly the neutrophils, they have the shortest lifespan, that is less than 24 hours. Next comes the thrombocytes, which is having a lifespan of 8 to 10 days, and the most longest lifespan, it is of the erythrocytes, which is having a lifespan of 90 to 120 days. So this is the about the lifespan of these cells. Now we look at what are the hematopoietic organs. So students, beginning with hematopoiesis, when we look at the entire in the embryology, where the hematopoiesis begin, how it is being slowly and gradually the responsibility of hematopoiesis is being transferred to the bone marrow, let's look at the journey of it. Now starting with the hematopoietic organs, we'll be discussing that the human embryo, in the embryonic life, when the embryo, at the time when the it is in the mother's womb, what do we find is in the human embryo, the yolk sac, it is the main site for the first few weeks of gestation. The erythropoiesis, what is going to occur, it is the organ, it is called as the yolk sac. So the yolk sac is the site where erythropoiesis occurs for the first few weeks of gestation. Now later on, by third month of intrauterine life, the responsibility of erythropoiesis is taken up by the liver and spleen, which becomes the main site of erythropoiesis by third month of intrauterine life, and they continue to form this blood cells. The hematopoiesis is being continued by the liver and spleen till about 2 weeks after birth. So actually, by third month of gestation, the responsibility of erythropoiesis is being conducted by the liver and spleen. This becomes the main site, and the liver and spleen, they continue to conduct the hematopoiesis. They continue to be the main site for hematopoiesis by about 2 weeks after birth. So after the birth of the baby, after 2 weeks of the birth roundabout, still the erythropoiesis up to some extent is being done by the liver and spleen. Now, moving on, that hematopoiesis commences in the bone marrow by about fourth and fifth month. So do remember, viewers and students, by fourth and fifth month of intrauterine life, the hematopoiesis is commencing in the hematopoiesis commences in the bone marrow by fourth and fifth month and becomes fully active by 7 to 8 months. So this process of hematopoiesis, as we all are very well aware, that it is being conducted in the bone marrow, and particularly in the bone marrow of the long bones. In the adults, it is responsible for the hematopoiesis. But in the embryonic life, what do we see? Hematopoiesis commences in the bone marrow by fourth and fifth month of intrauterine life. So it is going to start by the fourth and fifth month of intrauterine life. The bone marrow will start producing the blood, and this becomes fully active by seventh to eighth month. All right. So in the embryonic life also, by the fourth and the fifth month, the hematopoiesis is going to begin in the bone marrow and becomes fully active. When we look at the term fully active, by 7 to 8 month of intrauterine life, this hematopoiesis becomes fully active in the bone marrow, and so that at the time of birth, practically all bones contain an active bone marrow. So this is very, very important. By third month, the liver and spleen is the main site for hematopoiesis, but they will, apart from this, the bone marrows are also getting developed in the embryonic life, and they are becoming ready to perform the hematopoiesis. So by fourth and fifth month, the bone marrow is going to commence the hematopoiesis, and by seventh to eighth month of the intrauterine life, the hematopoiesis becomes fully active, so that at the time of birth, practically all the bones contain an active bone marrow. Now, looking at, very, very important, that during the normal childhood and adult life, what is the site of erythropoiesis? Bone marrow is the only source of new blood cells. So in the normal childhood and in the adulthood, it is the bone marrow, it is the site for hematopoiesis. And however, during childhood, there is progressive fatty replacement throughout the long bones. So slowly and gradually, there is progressive fatty replacement, so that by adult life, the hematopoietic marrow is confined to the central skeleton. So viewers, do remember, in the long bones, there is fatty replacement. Slowly and gradually, the long bones are undergoing certain kind of a progressive fatty replacement is taking place, so that by the adult life, the hematopoietic marrow is confined to the central skeleton. So that will be confined to the central skeleton, and what bones will be involved? It is the vertebrae, the sternum, the ribs, skull, sacrum, and pelvis. So these will be the sites in the adult, and these bones, the bone marrow of these bones are going to form the blood, the formed elements of the blood. So hematopoiesis is confined to the central skeleton in the adult life, in the bone marrow, as well as in the proximal ends of femur, tibia, and humerus. So last, even in these hematopoietic marrow areas, about 50% of the marrow consists of fat. So students and viewers, do remember that even if that is the hematopoiesis is being confined to the bone marrow of long bones, and particularly the bones of the central skeleton, so the 50% area it is of the marrow consists of fat. So even in these hematopoietic marrow areas, about 50% of the marrow consists of fat. So slowly and gradually, as the bones are going to develop, so there is progressive fatty replacement throughout the long bones. So fatty replacement occurs, and 50% of the marrow consists of fat. So students and viewers, this was a very short discussion about the introduction to the hematopoietic system, where I've tried in simple terms to give you an idea about what are the formed components of the blood, what is the process of hematopoiesis, what is their lifespan, and the hematopoietic organs, the hematopoiesis is beginning from the intrauterine life to the adult. How and what is the site for the hematopoiesis? So students and viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming video. If you like this video, give this video a thumbs up.